Good afternoon. It's Dr. David Kemp. I'm here to discuss a little about why I got into chiropractic. Okay. Now, I was a student athlete around the age of 13, and I got injured playing football. I injured my neck. It created arm symptoms. I was carted off to the emergency room via ambulance. I was told then that I needed neck surgery and I'd never play football again. That's when I was introduced to chiropractic a little more. My father was a chiropractor. He looked at the x-rays, said I'd be back on the field in approximately 2 weeks and asymptomatic. And when I had a lot more respect for the profession. Now granted, I was a young athlete, so I was in good shape. I handled well to an activation type of adjustment. Now, this led me into the field of chiropractic because I respected it more, because it helped me and it got me back on the football field, which at the time that was my goal, was football. Now, after 4 years of undergrad and 4 years of grad school, I come back to Jacksonville as a chiropractor, thinking my dad with 30 years of experience and with my new knowledge that I've got from college that I'd be like the best doctor in Jackson. About a month into that didn't work out so well. So I have a 75-year-old female with neck pain and radicular symptoms, we'll say Miss Jones. I treat her, one visit, asymptomatic, right? Wiped out her symptoms immediately. So it was very similar to mine. So I thought, wow, this is going to be great. I'm going to be a very good doctor here. And then, unfortunately, a week later, I have another 75-year-old female with neck pain and radicular symptoms, and I treat her, and she doesn't get any better, possibly a little worse. That startled me. Right? I go right back to my father with 30 years experience, and I go, what happened? What did I do wrong? And they did nothing wrong. I don't know what happened, but I know someone who does. And that's why I was introduced to Dr. Frederick Carrick and Functional Neurology. Now, it was chiropractic neurology then, and that has changed into functional neurology. We have evolved. And Dr. Carrick coined the phrase functional neurology. Now, it's being used quite a bit now, but it's still the right term. Okay. Dr. Carrick gave me power. Now, he taught me that as a chiropractor, you're a musculoskeletal expert. Okay. But the brain, the nervous system, controls the musculoskeletal system. So if you don't understand the brain, you're just a glorified therapist. And that really struck my ego. Right? I was a doctor. I spent 8 years in college. I spent a lot of money, so that bothered me. So I started his program. And he gave me power. He taught me that the brain is the master system. It controls all other systems. It receives, transmits information. Right? Pretty simple. Needs 3 things to survive. Needs oxygen, fuel, and to be activated. Now, we learn that in cell biology too. The cell needs the same thing that the brain needs. So that made a lot of sense. Kind of neuron theory and functional neurology met together. So we know that if you're breathing, and if you're moving, and if you're eating, that you should be functioning pretty well. So all these 3 components are assessed when we examine any patient. And if one of those are missing, you're not going to do well. Kind of like the legs of a stool, right? You can breathe, you can eat, but if you don't move, then you're going to fail. So when we take that into an exam, it gives us a lot of power. Now, if we are going to look at you in functional neurology, and we're going to look at your oxygen, right? Are you breathing? How many respirations do you have per minute? We're going to put this perfusion index and pulse oximeter on you and measure how much oxygen is inside your bloodstream. Now, I know it's pink, but give me a break. It was 50% off. So, next thing we're going to do is we're going to measure your chest expansion. All right? We're going to wrap this around your chest. Inspiration, expiration. Is it 4-inch difference? It should be. That's normal. Right? So if your chest isn't expanding, then you're losing oxygen. At sleep, at exercise, right? Are you developing asthma when you exercise? You have exercise-induced asthma, or you just have a decreased rib cage and you can't breathe enough? All right, we don't know. That's what exams are for. Now, the next component is activation. All right, activation is a big component. All right? Are you exercising? Are you doing the right exercise? Are you sitting on a bike and not moving your arms? Not such a great exercise. Are you out there, using that treadmill, moving your arms, or are you holding on to the treadmill? Right? So there's going to be some exercises are good, some aren't. All right? And if you don't know, then you need to get to the right doctor to find out. Now, the last component is going to be fuel delivery. Now, in America, this is kind of a big deal because the American diet isn't so good, right? And everybody wants their food fast, and they don't want to suffer with heartburn indigestion, so they take drugs to get rid of it. Well, that basically just tells you you're not breaking your food down, you're not absorbing, or you're eating food that you're allergic to. Okay, so fuel delivery is a big deal. Are your proteins breaking down amino acids? Are your fats breaking down into ketones? If they're not, then you're going to have a hard time forming a cell membrane, because that's what a cell membrane is made of, a phospholipid bilayer. Right? So if you're not breaking this stuff down, then you got leaky cell walls, and you can't hold stuff inside your cell, so you get tired all the time. Right? One day you're good, you got enough stuff in the cell, one day you're not. So You know, it's really important because as you get older, if you don't have a good cell membrane, then you're not going to be very healthy when you're older. Okay? Now, looking at all three of those aspects, you're going to get a good idea of what's going on inside your system. Now, functional neurology, that's what we do when we're looking at those three systems. Okay, so if you feel like that could help you, then get yourself to a functional neurologist. There's one here in town, and you're looking at